Trang and me, do you have an idea?
Miss Chang, do you have any idea?
I'm just thinking about this little. Actually, we have the master plan to improve modernizations of Vietnamese healthcare.
So you like education, government put more investment on education about health, something.
I don't think education is the strength of Vietnam in healthcare.
I don't know. I don't know, but I just read an article this morning that Vietnam education system just ranked on the top 20 countries, top 20 best countries in the world.
Bad countries, really?
Okay, so let's say more investment on education. Help. Okay. I say living standard. Better living standard.
So what about private health insurance sector?
Excuse me, can you say that again?
It's about the private insurance sector. Because with the living standard just improves that, the more developed, and the people will more interest in the private health insurance sector. For example, they will buy some living insurance.
So you say like there's more and more private companies and associations working on the health assurance. So we have more choices. Yeah, we have more choices. Okay. Two more. I say Vietnam is more open to the world and more access to tech, the most modern technology health care. Last one. You so quiet today though.
Not easy, but just thinking about.
Well, I just write my ideas, and if you have something,
I think that the last one is the hardworking day, or the people to do their heavy lifting. So there is a case of exercise.
So people are more aware.
Yes.
Aware of aware of what
The importance of exercise.
Their health. Okay.
By doing exercise.
I think today Miss Kang voice is very strong.
Huh?
Yeah.
Very strange.
What happened?
Miss Kang today is very different.
What do you mean by different?
The voice.
Maybe I have some problem with my sore throat.
Yes.
Okay. Okay, let's move up to the bottom actors.
I think that the bottom up actor who should be a part of the partnership for better health in Vietnam, that is the teachers or the patient or the doctor. The bottom up.
Okay, so actually I have done it this morning for some ideas and ready here. So let me copy in here. Then if you disagree with me, then we will add more. Or you have anything that you disagree with, then just discuss further.
The local government is top down, I think.
This is local government. So the top down here also mentioned about the national government.
National government is so high. Okay. Yes, you can say local government, or we can use top down, but the really very close. That means we can use the doctor or the patient or or educator who can train the people or educate the people, the local people for their health care.
Yeah, it's here. It's number 2. It's school, university, companies, factory, association, local healthcare centers. So actually number 1, so every
I think school, university is outside in.
outside in.
Outside in.
Okay. Okay, let's move back to, let's go for number 1.
You know that with the bottom up, that means the people who is related, who are related to the problems. That means something with the help. Some factors to direct or to guide the solution. And the outside in, we can use our other help or facilitates. I mean the
Okay.
three dynamic of the bottom up or top down or outside in. I think so. How about you, Diễn? You are master MA student. You already studied the last semester about this.
Bottom up, I think if you write any visual, it's so generous. We need to speak. Again, what about government? Because government have a very important goal to develop healthcare system in our country.
But I think that the government with the roles of the so I think that is a top down, not bottom up.
Oh, top down, I don't think government is top down. Top down patient or some people have.
No, patient is bottom up. Patient and doctor or health care center is bottom.
Yes, healthcare staff, healthcare provider.
Yes.
And can you add
Patient.
healthcare provider?
So number 1 is healthcare
Providers.
provider, or patient, or doctor, or something like that.
What about educator?
Yes, educator can be bottom up or maybe outside in. It depends on the perspective of our what we want to look.
In healthcare innovator or inventor. I mean something try to find or do some research on how to treat some gen illnesses or try to find solution to the problem. Who are they?
Another idea that's been about a scientist, because with the scientists sometimes they have some scientific research or they can do some training or technical skill transfer for some lower level hospital.
Sandwich. Okay, I think that's good. And what about sandwich?
And number 4, about the volunteer.
Pardon?
What about volunteer?
Volunteer?
Yeah, because some of like I can say that some of organization they have also like need the help from the volunteer to do something in the hospital or some of nurseries.
Mr. Yi, do you think volunteer is related to outside in or bottom up? Mr. Yi.
I think that if we say that the volunteer is outside in, the scientist outside in, because there is the help from the other one. Like the example, the last time we have, that means outside in we have some material or something to help the community.
Okay. Can we move to the next and later we will go back top down? Patience.
Top down is patient. You think so?
Because
patient is bottom up.
Bottom up. Patient
Yes.
who need medical treatment, so I think they are.
Top down. That is the.
I'm wrong. Sorry.
Remember, top down is the policy. Not the patient is the bottom up. Patient, doctor, or healthcare provider, something like that is the bottom up, top down.
Yes. Can you add number 4 in bottom up? Patient. and are you there?
Top down, we can use some policies, health policy from the government.
Policy. The government.
or some preventive treatment. Or some
Actors.
like vaccine or something like that, preventive treatment like vaccine.
Sorry, actors mean about people.
What?
Actors. We need mention about people.
No, I don't think so.
It's in a very difficult topic. What about outside?
I think outside in is scientists or volunteers or educators. Like that.
Will volunteer. I will with you volunteer for.
So what about top-down actors is foreign funded or foreign-owned hospital?
Yes, I remember that outside in we can use another one like donor.
Donor check.
You can use the money to help the poor people.
Donors and volunteers.
Scientists, volunteer, or
Donator.
Donor. OR. Yes.
Yes. And volunteer.
Volunteers. Educators, maybe. Yes.
Similarly, we mentioned educator already. Okay.
Remember that one rows we can have some other sides is okay. For example, you say educator is the bottom up is and is it outside in is okay.
Got it.
Yes. Or the governor. Maybe outside we can say the governor. Or
A lot of things we need to do.
maybe we cannot finish this a lot of things like 5 or
1 minute left.
And a lot.
But I think governor is that a kind of top-down actors because
Yes.
do a lot of the policies in there, and they also reform the health insurance system.
Right, you're right. I'm not sure that you have read this instruction earlier, but if you didn't read it, then you should read it again. And if I who belong to what group. Anyway, I'll send the file via email.
Bottom up maybe one of the like Red Cross organization.
Yes. Grassroots, we can say outside.
Hello, my friends. Was that a difficult task?
Know that with limited time and a lot of questions, you cannot run through of them.
We need a month,
Yes.
Katie. We need a month to answer those four principles.
Yes. Well, I wasn't expecting you to teach them the 4 principles, but just to briefly fill them out for health. But it is difficult.
But I think that when you know that we lack of time, you should divide group with the only answer 1 or 2 questions. It will make it easier for to answer all of the questions.
Good idea. Next
I
time.
understand that point, but all 4 principles fit together. So if one group did principle 1 and a different group did principle 4, the 2 don't connect. I think the answer is more time.
Yeah.
Because to break it up would be to take the meaning from the whole set.
And I think that you should review the bottom up, top down, and outside in. Okay, we discussed about loss.
Understand the conception need a lot of lessons.
Yes, need a lot of
Even though we
lessons.
went through the ACC 601, but it takes quite a lot of time to figure out the conception of each, and then associate with something in the local community. Even though like it's quite hard to list out all of the 10 or 5 items.
And your question is the actors and not the factor.
Yeah, actors. What do you mean factors?
It's really actor.
The government policy is the factor is not the actor. Actor is more person, right?
But who
Yeah, no. The partnership is between people or organizations.
Yeah.
So a top-down actor could be the government.
Yes.
Right. An actor can be one person, or it can be the UN, it can be the Vietnamese government, it can be a corporation, it could be a community. You define it.
So did everybody get to principle 4? No, principle 3? Not a problem. So
Katie, can I suggest we save like half an hour next week, continue with the other 2, because I think it's really interesting to discuss what all of the group, especially mine. So
okay.
we can contribute for the next 2 principles to finish this. And I think it's really basic to understand the 6 scale. When people thinking of the healthcare, they just think like medicine and doctor. They're much more than that, like environmentalists or like different.
Oh, yeah.
Than that.
That's a good reflection, and I see other people's heads nodding. So it looks like we've built that kind of contextual mindset that we're not just talking about doctors when we talk about health, but it's all these other factors. So I think we've reached that point of thinking. So you're right, next week, if we finish the last part of the worksheet, you can give us some other good, meaningful responses. Dan, what are your thoughts on that?
Yeah, this is complex, and we can certainly spend more time on it. We have 3. We have 2 forms. Today is the 8th form, so we have 2 more.
Yep.
So if we take a second week on health, then we will cover 9, not 10 topics. So when I'm in Gantau with the Ganta 8 and the other 10 or so that have been joining our forum regularly, they're in person, we can work on the 10th issue. But the time that and we need to address this as a group. We need help getting the interviews done of the people who have been identified as the profile people. So for each of the units, we need the interviews done so that we can turn those into stories, so that we can have pictures and get the chapters done.
And I'll print out all the materials we've created in these forums, and Dan and I will work through them today before him and Liz jet out to West Virginia, so that we can effectively assign interviews. Okay, well, next week we'll continue with the health topic. I'll let your minds continue to think on that for a week. I will also send you an assignment to review those symbols, icons, and give us your feedback on those.
Yeah, that was helpful. Thank you at the beginning.
Can you collect all of the reporting thing today? And then people will keep on that next week. We will send the recording too. So I think you should keep that before next week, like we start with the second or the third one.